On this edition of Independent Sources, death disparity, the growing gap in the life expectancy between New York City's rich and poor, and a safe space. A New York University center reaches out to Muslim students seeking refuge.
Independent Sources, your window to the city's ethnic and immigrant communities. Here's your host, Gary Pierre.
Statistics from the city's Department of Health and Human Hygiene show that your zip code is having more of an impact on whether you live to 75 or 85. Despite the city's overall life expectancy being up, the gap between rich and poor neighborhoods is at an all-time high. City Limits magazine recently published a 4-part series on this growing gap and how the affected communities are responding. I spoke to the authors of the series, freelance reporters Ruth Ford and Janaki Chadha, to learn more. I want to start by really congratulating you guys on a terrific piece of reporting, a very important issue. But your reporting looked at the city at large, but you focus on Brownsville section of Brooklyn. Why, Janaki?
Well, I think when you look at health disparity, there's so many different factors that go into what exacerbates something like that. And I think looking at Brownsville, you see so many of those individual factors in that neighborhood. So specific conditions like asthma and diabetes showing up at higher rates, but also social factors showing up at higher rates. So things like unemployment and incarceration rates and housing issues, being especially present in this neighborhood. And I think, you can, other neighborhoods in the city with high poverty levels are certainly similar, but I think in Brownsville, specifically when we started this series, I think a lot of those issues seemed
amplified.
Yeah, exactly.
Okay, interesting. So Ruth, one of the things that you guys touch upon in the series is the role of basically economic dislocation.
Yeah.
And the role that plays in health disparities. A lot of people don't think of it that way. Can you elaborate upon that a little bit more?
Absolutely. There was a study done over the summer, and it was a study that was headed by Roger Green, former assemblyman who is now at Medgar Evers College. It was done in tandem with students from Pratt and MIT CoLab, and they interviewed over 500 people across Brownsville and East New York and looked at a host of factors affecting healthcare. And joblessness was an enormous factor that came through, either no paycheck or low paycheck. If you look at Brownsville, I think it's something like 1 in 6 people over the age of 16 has no job. I mean, that's an enormous number. It's not a big neighborhood. There's roughly 88,000 people in it, but there are so many people who don't have work or have only part-time work. And when that is the case, whatever health condition that you have is simply not, it's just not going to be addressed. It's not going to be the highest priority. Getting a job is going to be the highest priority. Finding housing is going to be a higher priority.
Is what part of what's driving the health disparity is to look at the economic people not having a job or a low-paying job is that they don't have health care at work, so they don't have places to go to seek health care because they don't have insurance. How much of a role that's playing in your reporting?
I think it's definitely a part of it, an important part of it. But I think, the reporting that I think in both of our reporting, we found that I think a lot of experts and other people who've been working around these issues kind of pointed to factors that go beyond, simply insurance coverage and access to care. So what's kind of often termed social determinants of health. So factors like employment and housing and all of these other factors, access to healthy food, playing a factor, and a lot of people talking about how those factors haven't been given maybe enough attention in the past, and how that kind of needs to change when we look at the health system.
Okay. And Ruth, when you look at sort of like the mismatch between the current funding model and the realities that the people in these communities face, where do we go from there? I mean, how do we address adequately the problem of these health disparities and the consequences in communities?
That's a great question, and that is, I think, the biggest question right now, certainly across New York City, New York State, the nation, but in Brooklyn, there's a couple of different things that have been happening. So the way healthcare is now distributed across New York State is through 25 different systems. They're called PPSs, or performer providing systems, and it's a way to gather people.
And give people an example tangibly what.
Sure. So Community Care of Brooklyn is the big one in Brooklyn, and that's led by Maimonides. So what the state, Governor Cuomo is trying to do is give money to hospitals in Brooklyn so they form a network. And I'm talking about the safety hospitals. So we're talking about Interfaith, we're talking about Brookdale, to give them money to improve their infrastructure so they can improve their facilities and they can draw in a larger patient base. And it's not enough money. It's $700 million. It's not enough money, but it is a start. I think improving the hospital facility, the infrastructure, is a huge first step in improving access to healthcare and health outcomes, absolutely.
Okay. So, Janica, Brooklyn in particular has had lots of problem with hospital closures, poor performing hospitals. So what role is that playing in health disparities in the borough?
Hospital closures, I mean, patients not having access to primary care. I mean, a lot of these communities are very reliant on emergency room visits, you know, for, that's, I think, a lot of, you know, where they access care through the emergency room a lot of times. And so I think you're seeing that kind of being cut off in these communities, which, you know, has serious consequences.
And so what about the Affordable Care Act that's on the chopping block now? I mean, that would have a devastating effect in these communities, not just in Brooklyn, nationwide. Yeah.
Absolutely. Republicans have talked a lot about rolling it back. I think everyone is unsure about what that would actually look like. The thing about the Affordable Care Act is it attached people to insurance, so people started to go to the doctor's office for the first time, where it was discovered that people had many underlying complicated conditions. If that is rolled back, if people fall away from care again, you will have a national health crisis, I think, the likes of which we have not seen. And particularly, in some ways, New York is weirdly lucky, but because we have this system now that has been in place where we get our money in a block from the federal government that is then fed through these 25 different hospital systems, we are in a slightly better position because of the way the money is now coming through. But the Affordable Care Act does things like it brought more people on, it spread Medicaid more broadly, so more people have Medicaid, so they have access to care without copays. If that's rolled back, that means that people will now have to pay to go to the doctor for primary care, for maternal care, for reproductive care. I mean, people who already have a very fragile alliance with the healthcare system could very easily be pushed away from it.
Sure. So what role is the city playing in this? I mean, is it increasing funding to tackle this problem?
I think there have been initiatives in recent years. You know, one of them that was mentioned in the article, Take Care New York 2020, which is, you know, one of the priorities of that plan is to kind of broaden the focus when it comes to working on health issues. And so through that plan, the city is working with 8 community-based organizations across the city. One of the ones that I spoke with was based in Fordham, and you know, they're allocating funding to these organizations to create a neighborhood health action plan. So really kind of getting into, you know, community-based approaches. And in this organization, the Northwest Bronx Community and Clergy Coalition in Fordham, had community health forums in the fall, and one of the focus areas that they settled on was decreasing violence in the neighborhood. And then at a subsequent forum in December, they settled on workforce development efforts as a way of combating violence in the neighborhood. So you kind of see when I guess communities coming together to work on health issues, you see all these other issues kind of coming into play in that.
Yeah, that was kind of interesting. Something segue right into the question I want to ask you, Ruth, is that, the non-traditional ways of combating health problems,
Right.
like parks, for instance. Can you talk about that?
Well, I think certainly in Brooklyn, the Brownsville Multi-Service Family Health Center has been integral in drawing in different players within Brooklyn to help address some of the, as we've been saying, the social determinants of care. So when there is a diabetes group, people, working with people who have high rates of diabetes in Brownsville, I think almost a third of folks have diabetes, nearly a third are chronically obese. What they also have are cooking classes. And the goal of that is to show people there are other ways to eat, there are ways to cook. I mean, just in Brownsville alone, the highest percentage of people in Brownsville are under the age of 18. The smallest percentage is people over the age of 65. The knowledge of how to cook, of how to shop is very thin. And there is a real crisis in terms of just managing your own health care. It has, I think, the highest self-reporting of sugary drink intake. I mean, these are things that have to be combated really at every level.
But it's interesting because former First Lady Michelle Obama had this initiative of healthy eating.
Right.
And from what I understand, a lot of these products are not being, the children are not eating this healthy stuff.
Right.
So where do we go from there?
Well, I think what I found was, I think, again, it highlights the need for, I guess, community-based outreach, and a lot of people saying when you kind of tell people in a community you have to eat more fruits and vegetables, but they go to their local bodega and the availability or supply of those things isn't there, or it's not, I guess, culturally conscious in terms of what is the cuisine of different cultures living in this neighborhood. Then it's unrealistic to expect that there will be changes in the diet of a community overnight.
Ruth, same question?
I think the Department of Health is really trying to tackle this head on. They're creating 7 neighborhood centers around the city, 3 of them in Brooklyn, to specifically address these kinds of issues of access to food, how to prepare the food, having fitness groups, encouraging people to go to the doctor. I mean, it's sort of this multi-pronged effort that has been coming together that, despite the drumbeat coming out of Washington, it seems like, and hopefully will continue, a real commitment on the part of the city to really, really drill down on why are people so much more unhealthy over the past 10 years. I mean, the health outcomes, I mean, somebody living in Battery Park City, life expectancy of 85.9 years. In Brownsville, 74.4. It's an 11-year spread. I mean, it's outrageous. It is absolutely outrageous that your zip code right now is absolutely at a baseline level the determinant of your health outcome.
Unfortunately, we're out of time. Ruth Ford, Janaki Chadha, thanks for joining us.
Thank you.
Thank you.
Thank you very much.
When we come back, an NYU center offers solace to Muslim students seeking a refuge from hate. Thanks for staying tuned. The Islamic Center at New York University is offering a safe space to Muslim students at a time when Islamophobia is on the rise in the United States. Students from across NYU's campus are going there for spiritual services, interfaith dialogue, and building community, as well as to promote a better understanding of Islam. Producers Marissa Holmes and Bruno Giuliani filed this report.
The Islamic Center is to cater to our upwards of 3,000 Muslim students on campus and the Muslim community in New York City in general, and often we like to create this community feel. In fact, the motto of the Islamic Center is what a community should feel like. Muslims have been marginalized in this country, since post 9/11 and maybe even before that, and oftentimes they're seeking an identity, and this space goes toward, allowing them to be empowered by their faith, by their identity, by their culture, by their diversity. So without a doubt, we try to be very inclusive of the community in general. Anyone is welcome to come and visit and utilize our resources and so on. So we have 13 Muslim student groups on campus. We have regularly weekly programs in the evenings for students and for, again, the community at large. Anyone is welcome to come. Oftentimes we discuss like matters of, ethics and spirituality and, matters of religion, but again, in order to like cater toward this large, diverse group of people that we have. And in light of like the immigration policy, again, a new issue that we have to deal with. So while other students, thankfully have to just worry about, getting A's on their exams, our students are worried about, whether or not they can continue to live in this country, in addition to all of the other type of remarks, racism, rhetoric that they have to deal with on a day-to-day basis living in this world that we're living in right now.
I started wearing this hijab 3 years ago. And when I did, I had tons of friends come up to me and said, "Sana, you're so brave." As if my being Muslim wasn't just something that I could be, but was something that required courage. And I never even really saw it that way. Yesterday, I woke up to realize that there was a large part of this country that didn't want me here. That there was a large part of this country that either agreed with everything that was said or was able to push it to the side when ballots were cast. I woke up to realize that there was someone on this campus that was very clear about not wanting me here. And yesterday was the first time I ever felt brave for putting this on my head.
It's not something I was brought up with. I wouldn't always identify as Muslim that at the forefront. But now, I think being here, being surrounded by so many Muslims, being both so supported in that sense and growing spiritually, I decided to wear it because I just thought it made up such a big part of who I am. Then why shouldn't it be one of the first things you know about me? But I think the election and everything that went on during the election and then the results put me in a very vulnerable position, made me a little more scared to be wearing it. When I walk outside, I'm in Manhattan. I don't know what people are thinking. I don't know who voted for who. But it can be kind of scary. And I think knowing that we have these resources, knowing we have this community, knowing we have so many people that came through for us just to hear from us, I think is really comforting in a lot of ways. And I think when policy and people start pushing forward injustice, we should all be outraged. We should all be doing something about it. We should all be standing up for it, regardless if you come from that community or not. And I think that's probably the most important part, is that stand with us, not just on a metaphorical sense, but stand with us in a physical sense, stand with us through your actions, because that's where change happens.
When we come to a gathering like this with I don't know how many thousands of people, we organize together, and we stand up together, and we speak out with one voice. But in the reality of the situation is that there are individuals, there are children who are bearing the brunt of the rhetoric that we've been hearing for the last 18 months. When we hear the news of upwards of 1,500 hate crimes that have taken place post-election, what we have to understand and what we have to realize is that in the midst of hearing all of these tragic stories, in the midst of hearing all of these upsetting anecdotes, there's one silver lining in the midst of all of this. And it reminds me of a prophetic tradition that comes from the Prophet Muhammad, in which he states that in the midst of oppression, in the midst of a tyrant, there's often an opening for those who have faith.
Years from now, we're going to have a responsibility to determine which line are we stood on. Were we standing in support of marginalized communities, or are we standing on the opposing side? And I believe that it's a human matter, a matter of my self-conscious, that if I'm not doing something, or if I'm not being an example, for my community, for my children, then I'm not offering any sort of support. I'm not doing anything positive. So there's an opportunity for me to, humanize the religion of Islam, to present my faith and my tradition, with some sense of normalism, then, I'm ready to stand up for that cause.
Still to come on the show, why the abolitionist Frederick Douglass's words still hold sway today. Finally, from us, On the Shelf. This week, we focused on the book Frederick Douglass in Brooklyn. The volume compiles a series of speeches the abolitionist leader and spokesperson for racial and gender equality delivered at various Brooklyn locations. I recently sat down with Ted Ham, the book's editor, to talk about why Douglass is still relevant today. So, Ted, a book about Frederick Douglass, why now?
Well, I mean, Frederick Douglass is relevant at all times and periods of American history, but it does seem pretty relevant, especially relevant, given what we're experiencing now. I mean, obviously I couldn't, when I was starting to put together the book, I couldn't foresee what was on the horizon, that Trump and his rise and so on, but throughout the last several months, as we've seen the racist appeals he's been making throughout his campaign and so on, and now with the transition from Obama to Trump, it just seems like there's a lot of stuff that Douglass was talking about. But you know, he's always relevant at any period, as I said. And you know, Brooklyn in particular is undergoing some dramatic changes, as you know well, and we're seeing the gentrification of Brooklyn beginning to erode some of the black population space and size of it and so on. And you know, that's really one way to think about what Douglass he represented at the time is to sort of work backwards and think about, you know, over the last few decades, Brooklyn has become a hot destination, whatever the brand, whatever you want to call it. But it's had historically a very prominent black population for the last few decades, since World War II, really. You know, Jackie Robinson, the rise of hip hop, Spike Lee, and so on.
The Bronx would have some issues with that, but
well, yeah, I don't want to take away the Bronx's role. More like some of the prominent figures.
Sure. You know, you have Jay-Z and others now. But so, on a social context, what does Frederick Douglass's work and words, how do they relate today?
Well, they remind us what Brooklyn was like in the mid-19th century when he first started coming, which was a very hostile place. It was very strong ties between Brooklyn merchants favoring slavery and so on. One of the ways to look at that is, or to illustrate that, is that Brooklyn, like New York City, both times 1860 and 1864, voted against Lincoln. Lincoln lost the city. And both Brooklyn as a separate city and New York City at the time lost both of those in both elections, but he won New York State. So it's a total flip of what we know today, which was upstate was much more radical. That's where Douglass was centered in Rochester and so on. So he was coming to a place that was very fraught racially, but also very influential in terms of abolitionism. You know, of course, Henry Ward Beecher, considered to be the most famous man in America in that moment, was a very prominent abolitionist in Brooklyn itself, at Plymouth Church as his center. And then he had his ally Theodore Tilton, who Douglass became closely connected to, who was a newspaper editor. And then he was tied to black abolitionists in Brooklyn. There were some strong networks, whether at Weeksville, prior to when Williamsburg was a separate entity in the 1840s and 1850s that had a strong abolitionist community, and then downtown Brooklyn in the area around what's now Metrotech.
What made you want to write a book about Douglass's time in Brooklyn? Was it really historically significant, or is it something that you just thought that people should know about?
Well, I think it fills in a gap that people don't know much about his direct ties to all these networks in Brooklyn, and it illustrates patterns within Brooklyn history during that moment. So there's newspaper clippings that accompany the speeches in the book. They illustrate the racist hostility he faced within the local newspapers. So the Brooklyn Daily Eagle, which I see over here, was in that moment, in that era, was quite pro-slavery, anti-black equality, and they ripped Douglass and used the most racist characterizations they could find to come up with him, to describe him in that era. So you see Brooklyn and the hostility that he faced, also the ties he had to these abolitionists, black and white, in the borough, or the city, I should say, at the time. Right. But that begins to change. So he first starts coming in 1859, or he starts coming in the 1850s. The first speech in the book, when Walt Whitman goes to see him in Williamsburg, that's in 1859. The last speech is in Crown Heights in 1893. It's a Lincoln Day dinner where he gets this hero's welcome. It's a 10-course meal that starts with Blue Point oysters, and I don't know what the rest of the courses were, but that by the end of it, Douglass gets up and the newspaper account says that there was they sang for "He's a Jolly Good Fellow" with a vim that made the candle shades shake. So you could see this sort of rousing reception he's getting, and he then tells these stories of Lincoln.
One of the chapters that I find fascinating, the headline of the chapter is "What Shall Be Done with the Negro." It was a speech he gave at the Brooklyn Academy of Music in May 1863. Can you talk a little bit more about that?
Well, that was one of his first speeches, the first of two that I present in the book at the Brooklyn Academy of Music. And he's really addressing different scenarios of what will happen throughout the course of the war and into the aftermath of the war. And so he really wants to push for full black participation in the war, including the right to vote, and so on. So he's sort of at the forefront of pushing Lincoln, who was a reluctant figure, or cautious in his temperament and his approach to the war, and so on. Douglass is really pushing him in the direction of full equality that eventually Lincoln starts to move in right before he's assassinated.
Unfortunately, Ted, we're out of time. Thanks for joining us.
Pleasure. Frederick
Douglass in Brooklyn is available online and in bookstores. That's our show this week. Thanks for staying tuned. Till next time, be independent-minded.